So good morning to all of you. Today we start about the hand, okay, especially the muscles of the hand. Clear? So like the arm and the forearm, when we dissect superficial to deep, always there is क्या था? Skin, then superficial fascia, muscles, deep fascia, then the muscles, then is the bone. Okay. In the same way, again in the hand, there is a skin. Okay, there are some specific feature of the skin is there. There is superficial fascia. So in the superficial fascia, again there are two contents. These are superficial fascia में हमने क्या बताया था? क्या होता है? Cutaneous nerves and the vessels. Okay, and small amount of the fat according to the reason. Maybe the small amount or the large amount according to the reason. Clear? Then there is a deep fascia. Okay, and according to the reason, again the deep fascia may be the dense, as in the lower part of the forearm it is thickened to form the flexor retinaculum. Clear? As compared to the upper part of the forearm and this arm. Clear? So इसी तरह से there again in the this hand there is a thickened fascia is there. Okay, then deep to this deep fascia is muscles. Okay. And the muscles of the hand, they are named as the intrinsic muscles of the hand. Especially in the muscles of the hand, the long flexor tendons are also inserted into the fingers as this flexor digitorum superficialis and the flexor digitorum profundus. Okay, as we discussed in the section of the forearm. But the muscles of the, especially we consider in the muscles of the hand, the intrinsic muscles of the hand, which arises from the hand and inserted into the hand. Clear? So these are the small muscles as compared to the long muscles or the long flexors which arises from the forearm then inserted into the hand. Clear? So and just deep to these muscles, they are the bones which forms the skeletal of the hand. क्या हो सकता है skeleton of the hand में? The bone which helps in the formation of this hand. These are carpals, metacarpals and phalanges. Clear? So one by one we start. So first of all, when we dissect skin or when we start the dissection of this hand, we see about what is the features of the skin of the hand. Okay, as compared to the skin of the forearm and the arm, the skin of the hand is thick. अगर आप फील करोगे तो आपको लगेगा कि as compared to the skin of the arm and the forearm, the skin of the hand is thick, especially the palmar side of the hand. Clear? And there again there is the creases are found. Palmar crease जिसे बोलते हैं. Okay? Palmistry में जो हम लोग lines देखते हैं. Okay? So these creases they are for increasing the gripping powers. Okay? तो अगर ये पूरा एक स्मूथ होगा कोई क्रीजेस नहीं होंगे तो ग्रिपिंग में प्रॉब्लम होगा. क्लियर? सो दे इंक्रीज द ग्रिप एंड दे आर नेम्ड एज द फ्लेक्सर क्रीज. ओके, एंड सेकंड थिंग, दिस थिकेंड स्किन इट इज टाइटली अडहेयर विद द अंडरलाइंग डीप फेशिया थ्रू द फाइब्रस सेप्टा विच आर फाउंड इन द सुपरफिशियल फेशिया. सो द स्किन, अगर हम स्किन को पिंच करें तो एकदम से आपकी पिंच नहीं होती है. इट इज टाइटली अडहेयर विद द अंडरलाइंग डीप फेशिया. क्लियर? And in the tip of the these fingers, there are the rheses are found, which are named as the whorl. Okay, there are different types of the rheses are there, and again the function of these rheses is one is the gripping, second is there is a for increase the sensitivity. Fingertips में जो है आपका अगर surface area बढ़ेगा तो कोई भी touch, pain, pressure जो भी sensations हैं आपके वो ज्यादा effectively feel होंगे. So these are the features of the skin. That means thickened skin मिलेगी, tightly adhere with the underlying deep fascia. There are the creases are found which are named as this palmar crease. Okay, and the purpose of these crease and the creases over these fingertips is to increase the gripping power of hand. And in the palm regions आपने देखा होगा कभी-कभी बहुत ज्यादा sweating हो जाती है, कोई चीज हम पकड़ते हैं. So there are abundant amount of the sweat glands are found. अभी तक हम लोग ने glands की बात नहीं की थी. So there are the glands आपके others skin में भी होंगे other जगह पे, but there are the abundant amount of the sweat glands are found in the skin of the palm region. Now these are the bones of the hand. Okay, they are the carpals. Carpals कौन कौन से हैं? Scaphoid, lunate, trapezoid, capitate and hamate. Okay, so they are the 2 rows and there are 8 carpal bones. Clear? Then after these are the small bones. Clear? And after this, carpals, they are the long miniature bones are found which are named as the metacarpals. Okay, and after this metacarpal, again they are the bones of the fingers. They are named as the phalanges. Clear? And the phalanges itself, they are divided into, in the thumb, there are how many phalanges? 2 phalanges. And they are named as the proximal and the distal phalanx. And in other 4 fingers, there are 3 phalanges. So they are named as proximal, distal and middle and distal phalanx. Clear? And between these phalanges and the metacarpals, there is a joint form, which is named as metacarpophalangeal joint. Clear? Metacarpophalangeal joints, because the muscles of the hand, they helps in the movement of this metacarpophalangeal joint. Clear? And between this phalanges, this proximal and the middle phalanx and the distal phalanx, they are again the joints are found which are named as interphalangeal joints. So there are 2 interphalangeal joints. One is proximal and second is distal. Clear? ये basic चीज है जो आपको normally भी पता होनी चाहिए. ठीक है? And between this carpals and the metacarpals, again there are the joints are found which is named as the carpometacarpal joints. Clear? So these muscles, the muscles of the hand, they helps in the flexion, extensions, and they are the movements of the thumb. Okay, and the adduction and the abduction movements. These all movements they occurs at these carpometacarpal joints, metacarpophalangeal joints. Okay, and the interphalangeal joints. Clear? That's why we should know about the name of these bones. So these are again the bones of this carpal region especially, and we can learn this by the she looks too pretty and try to catch her. ये आप लोग याद करते होंगे इसी के according, lateral to medial. Now the features of the superficial fascia in the hand regions में क्या है? Again it is formed by the fibrous bands which connect the skin to the deep fascia. Okay, and these fibrous bands they divide the area of the palm into small compartments which is filled by the fat. तो आपको इस regions में fat भी मिलेगा which is found in small compartments. And second thing, as the features of this superficial fascia, there the cutaneous nerves and the vessels are found. And this cutaneous nerve supply हमने जो इससे पहले भी याद किया था, the structures which passes just above the flexor retinaculum. That means the cutaneous nerve of the cutaneous branch of the palmar cutaneous branch of the ulnar nerve and the palmar cutaneous branch of the median nerve. Okay, so the cutaneous nerve supply is by this, especially the palm of the hand. It is by this cutaneous branches of the median and the ulnar nerve, and there the vessels are also found to supply this skin and the superficial fascia. And one specific feature which is found in this, especially in the hand, there is a subcutaneous muscle is there. Okay, again to improve the gripping power of the hand, their features are found. Skin हमारी adhere है. Okay, there the creases are there. And again in the hand there are the prominences. अगर आप ऐसे देखते हो, there is on the lateral side there is a prominence, and in the medial side there is a prominence here, which are named as this thenar eminence and the hypothenar eminence. And again the purpose of this prominence is to improve the gripping. कोई चीज अगर हम पकड़ रहे हैं, in the middle it is hollow. Clear? So again to improve this gripping power, in this medial side there is a subcutaneous muscle is found which is named as the palmaris brevis muscles. And the origin, insertion, nerve supply and the action of the palmaris brevis muscle is, it arises from the flexor retinaculum. वहीं पर हमारा flexor retinaculum है, so it arises from this flexor retinaculum, and it also arises from this palmar aponeurosis, which is the deep fascia of the palm. And the flexor retinaculum is also the deep fascia of the lower part of the forearm. Okay. So this flexor retinaculum and the palmar aponeurosis से arise हुई आपकी palmaris, and the insertion is in the, because it is the subcutaneous muscle, so inserted into the skin of the palm on the medial side. Okay, the nerve supply is by, because it is a subcutaneous muscle, so it is supplied by the superficial branch of the ulnar nerve. It is found on the medial side. Medial side पे कौन सी है? Ulnar nerve. Okay, so it is supplied by the ulnar nerve, and action is because it increases this convexity of this hypothenar eminence. So the purpose of this muscle or the function of this muscle to improve the gripping of the palm. Now the deep fascia. Deep fascia of the palm, it is divided into three parts. The flexor retinaculum is also the part of the upper part or the proximal part of the palm or the distal part of this forearm. Okay. So, and the main triangular shaped thickened deep fascia which is found in the center of the palm, it is named as the palmar aponeurosis. Clear? And it is the thickened tendon or continuous with the tendon of the palmaris longus. Okay. And the second is the flexor retinaculum at the wrist, which we had already discussed. And third is in the fingers. Again in the finger region में भी हमारी thickened deep fascia है, which covers the long flexor tendons or the flexor digitorum superficialis and profundus. उनको भी तो cover करना है. Okay. So again in the finger region there is the thickened deep fascia is found, which is named as the fibrous flexor sheath of the fingers. Clear? Fibrous flexor sheath. तो palm region में स्पेशली आपकी क्या है? Palmar aponeurosis. Finger region में आपकी मिल जाएगी fibrous flexor sheath. Okay, it forms a tunnel through which passes these fibrous tendons, flexor digitorum superficialis and flexor digitorum profundus. And in the proximal part of this hand, it is covered by this thickened deep fascia, which is named as the flexor retinaculum. Clear? And all these fascia, they are continuous with each other. Flexor retinaculum is continuous with this palmar aponeurosis. Palmar aponeurosis, it brings slips, and these slips continuous with the fibrous flexor sheath in the palm. So this is a picture to show the central part. This central part, triangular shaped, आपको दिखाई दे रहा है green color का. This is the palmar aponeurosis. Okay, and in the proximal, this is a rectangular shape, a superficial to which there is a palmaris longus tendon, and this is the median nerve. Some structures are deep to it. So this quadrangular shaped structure, this is a thickened deep fascia over the carpals, and it is named as the this flexor retinaculum. And this triangular shaped area in the center of the palm, it is named as the palmar aponeurosis. Okay. And in the fingers, again these are the thickened deep fascia, and it is named as the fibrous flexor sheath. Now we discuss about this palmar aponeurosis, as it is the thickened deep fascia, okay, in the middle of the palm or the center of the palm. And the shape of this fascia is, it is triangular in shape. So there is the apex and the base. Triangular है तो apex और base होगा. Apex is directed proximally, okay, towards this and continuous with the tendon of this palmaris longus. And the base is directed distally. And base further it is divided into slips. Okay, and these slips then continue with the flexor fibrous sheath. So it divides into 4 slips for the medial 4 fingers opposite the head of the metacarpals and continuous with the fibrous flexor sheath. Now the margin of this, because it is found in the center of the palm, so the margin of this thickened deep fascia, it sends septa from superficial to deep, and these septa attached to the margins of this, the lowermost part, that means they attach with the bone. Okay, or the metacarpals. And then it divides this palm into the compartments. आप कह सकते हो, there is the central compartment which is covered by this triangular thickened deep fascia, palmar aponeurosis, and just the purpose of this. इसका purpose क्या है कि center में ही क्यों है? Because just deep to this thickened deep fascia or the palmar aponeurosis, they are the important nerve and the vessels of the hand. There are some important muscles are found in this deep to this palmar aponeurosis, they are the important, especially the branches of the median nerve and the ulnar nerve, and there is a deep and the superficial palmar arch, which is formed by the radial and the ulnar artery से मिलकर के जो बना हुआ है, which supply all the muscles of the hand. Okay, so the important neurovascular bundle is found just deep to this triangular area or the hollow of this hand, okay, palm. So that's why to prevent during the gripping, to prevent this damage of these structures, there is a thick and deep fascia is found. So these are this is a triangular shaped apex. It is continuous with the tendon of this palmaris longus, and towards the base is distally, apex is proximally, and they are the four slips which continuous with this fibrous flexor sheath. And on the side, it sends a septa which divides its compartment into the center part and the lateral and the medial part. And this lateral and the medial part of the palm, actually it is formed by the muscles of the thenar and the hypothenar eminence. And these group of the muscles are named as the thenar muscles and the hypothenar muscles. Now the function, again the function palmar aponeurosis इतना thicken क्यों है center में? As I said, it protects the underlying structures, that means the important nerve and the vessels and the muscles or the tendon. उसके नीचे से भी हमारी long tendons, flexor tendons which inserted into the fingers, they also passes deep to this flexor, this thick and deep fascia, that means the palmar aponeurosis. Okay, and it also fixes the skin of the palm and does improve the grips. That means skin of the palm is attached to this deep fascia through the fibrous septa which is found in the superficial fascia. Now there is a clinical importance of this. Sometimes when there is an inflammation of the, especially on the medial side of the palmar aponeurosis occurs, it leads the contracture or the shortening of this palmar aponeurosis, because this palmar aponeurosis is continuous with this fibrous flexor sheath, and because of the contractures, there is the shortening or the flexion of the fingers is found, especially this ring finger is affected. The middle and this ring finger and the little fingers, they results in the shortening. Because of the shortening, there is a flexor. So this position और ये आपकी straight नहीं हो पाती है क्योंकि aponeurosis हमारी contracture हो गया है और short हो गई है, ठीक है? So this condition is named as the Dupuytren contracture. This is a picture. किसी persons में आपको मिल सकता है. Especially it affect the ring fingers in the Dupuytren contracture. Then the flexor retinaculum. Okay, we had already discussed about this, and it is the deep fascia, thick and deep fascia, which bridge the concavity of this carpal bones and convert it into a tunnel, which is named as the carpal tunnel. Okay. And through this tunnel passes the long flexors of the forearm, which inserted into the hand. Clear? So there is attachments on the medial side attached to the pisiform bone and the hook of the hamate, and on the lateral side attached with the scaphoid, tubercle of the scaphoid, and the trapezium or the crest of trapezium. And on the lateral and the medial side, it sends septa. On the lateral side, there is a deep septa, okay, which attaches to the trapezium, and through the tunnel of this septa or the deep of this deep septa, there is a tendon of the flexor carpi radialis it passes. And from the superficial septa, it forms on the lateral side, through which passes the pisiform, through which passes this attached to the pisiform, through passes the ulnar nerve and the vessels, structures. This is the picture to show. This is the green जो एक आपको दिखाई दे रही है. These are the bones, hamate, okay, and this is the trapezium. So this is the fibrous flexor retinaculum, okay, और ये आपको एक septa दिखाई दे रहा है. On the lateral side, this is the deep septa, and from this tunnel passes flexor carpi radialis tendon. Okay. Now on the medial side, there is a superficial septa through which passes the ulnar nerve and the vessels. Now the structures just above the flexor retinaculum, below the flexor retinaculum, ये आपको learn होने चाहिए, पूछ लिया जाता है enumeration में. The structure which passes just above the flexor retinaculum. As seen in this picture, this is the palmaris longus tendon, and there are two palmar cutaneous branches of the median and the ulnar nerve, okay, and the ulnar nerve and the artery. Deep, they are the four and the 4. That means the 8 flexor tendons, 4 tendons of the flexor digitorum superficialis. These are the superficial tendons, and the deep are the flexor digitorum profundus. इसके अलावा डीप ग्रुप की एक मसल्स आपकी बची है. दिस इज द फ्लेक्सर पॉलिसिस लॉन्गस, बिकॉज द डीप ग्रुप की द थर्ड मसल्स ऑफ द फोर आर्म इज क्या थी? प्रोनेटर क्वाड्रेटस. याद है या उड़ गई सारी? डीप ग्रुप की फ्लेक्सर डिजिटोरम प्रोफंडस, फ्लेक्सर पॉलिसिस लॉन्गस एंड द प्रोनेटर क्वाड्रेटस. तो क्वाड्रेटस तो हमारी रेडियस अल्ना के बीच में ऊपर ही रह गई, और फ्लेक्सर पॉलिसिस लॉन्गस को हमें जाना है थंब में. सो इट इज अ डीप ग्रुप मसल, सो इट passes just deep to the flexor retinaculum, okay, and the important nerve which passes deep to this flexor retinaculum is the median nerve. So when there is a compression of this inflammation occurs in these regions, there is a compression of this nerve occurs, and the features which appears they are because of the compression of this nerve. So these are the structure which passes deep. Again, the median nerve, flexor digitorum superficialis, flexor digitorum profundus, pollicis. There is a ulnar and the radial bursa. It is actually the synovial sheath which is covered these tendons. Okay, this is found just near this wrist joint. So the synovial sheath, when we covers the four tendons, they form the radial and the ulnar bursa. And this flexor tendon of the flexor carpi radialis, it covered by this another or the separate synovial sheath. So when there is a compression because of the inflammation in this region, in the wrist regions or in the carpal regions, there is a compression of the structures which passes just deep to the flexor retinaculum. That means there is a compression of the nerve, especially the median nerve. Okay, and the patient complains of intermittent pain in the distribution of the nerve, or cutaneous sensation आपका चला जाएगा this on the palmar side पे, and also because of the irritation of the nerve, there is a muscle weakness may be found because supply the muscles of the hand, especially on the lateral side. So again, this is the picture to show the flexor retinaculum. This is the flexor retinaculum. Then the fibrous flexor sheath of the finger. It is again formed by the deep fascia, okay, thickened deep fascia, and it is thick and arched and form the tunnel over this finger, okay, through which passes it forms the osteofibrous tunnel for the long flexors of the forearm, okay, which inserted into this fingers in the distal middle phalanx and the distal phalanx. These are the tendons of the flexor digitorum superficialis and the flexor digitorum profundus, okay. And the purpose of this sheath is to hold the tendon in its position during the flexions, prevent the flaring of the tendons, okay, and keep in these tendons in its position during flexion. So the deep fascia of the palm, it forms the three type of the structure. One is the flexor retinaculum, second is the palmar aponeurosis. Palmar aponeurosis short note में पूछ लिया जाता है, okay, और डायग्राम इससे बना के आपको आना चाहिए. एंड फ्लेक्सर रेटिनाकुलम इज इंपॉर्टेंट, वो आपको बताया ही है पहले भी. द स्ट्रक्चर अबव द फ्लेक्सर रेटिनाकुलम, स्ट्रक्चर बिलो द फ्लेक्सर रेटिनाकुलम. इन्यूमरेशन में पूछा जा सकता है, इटसेल्फ डायग्राम और शॉर्ट नोट में पूछा जा सकता है. एंड व्हाट इज द कार्पल टनल सिंड्रोम, ओके, इन डिटेल वी विल डिस्कस इन द सेक्शन ऑफ दिस मीडियन नर्व, ओके. एंड द थर्ड इज द डेरिवेटिव्स ऑफ दिस डीप फेशिया in this hand is fibrous flexor sheath. Now we start the muscles of the hand, and these are because arises from the hand and inserted into the hand, so they are named as the intrinsic muscles of the hand. So they are divided into three groups: lateral group, medial group, and the central group. Clear? So the lateral groups, they are named as the thenar muscles. They forms the eminence which is named as the thenar eminence. So these group of the muscles, they are named as in a group is a thenar muscles. Medial group, it is named as the hypothenar muscles. Okay, they forms the eminence which is named as the hypothenar eminence. And another one muscle which is found in the medial group is the subcutaneous muscle. This is the palmaris brevis. In the center part, in the central group, they are the introchei and the lumbricals are found. Okay, one is the lumbrical. They are the 4 lumbricals, 4 palmar introchei, and the 4 dorsal introchei. Lumbricals, they arises from the tendon. They arises from the tendon of a muscle, flexor digitorum profundus. जो deep muscles जा रही थी हमारी, उसके tendon से arise हो रहे हैं lumbricals. Introchei, as the name, introchous membrane आपने सुना है, which is found between the 2 bones. So the introchei, the palmar and the dorsal introchei, they arises from the adjacent metacarpus. Bones arise हो रही है. Clear? And the insertion of all these muscles is into the, they goes into the dorsal aspect and inserted into the dorsum of the hand. In the, there is a dorsal extensor expansions. It is formed by the dorsal extensor digitorum muscle is found in the extensor compartment, which again forms the 4 tendons in the dorsal side. Okay, and because of this, by this extensor digitorum muscles, there is a formation of the expansion which is named as the dorsal digital expansions. And this lumbricals, introchei, both the palmar and the dorsal introchei, they inserted into this dorsal digital expansions. So the one by one we will start. The thenar muscles, these are the 4 muscles, okay? And these are the abductor, because they found on the lateral side, so the name is pollicis, सब में लगा हुआ होगा. Okay, one is the abductor pollicis brevis, flexor pollicis brevis, apponens pollicis, and the adductor pollicis. They are the 4 functions are found in the thumb. Okay, तो thumb के functions के लिए 4 अलग-अलग तरह की muscles हैं, 4 इसके function है तो 4 muscles भी. Clear? So these are the abductor pollicis brevis. That means it helps in the abduction of the thumb, okay, away from this midline. And the flexor pollicis brevis helps in the flexion of the thumb. Apponens pollicis brevis. Apponens is the functions where the tip of this thumb, it touches the tip of the other fingers. Okay. So for this there is the apponens pollicis. Then there is the adductor pollicis which helps in the adduction of the thumb. Okay. So 4 muscles are found which are muscles of the thenar. 4 hypothenar muscles, these are the same, because it is found on the lateral side, that means there is a little toe and this little finger, it is named as a digiti minimi. तो इस muscles के आगे हमने सिर्फ change किया है, वहाँ pollicis लगाया, यहाँ digiti minimi हमने लगा दिया. Okay? So the name is same, abductor digiti minimi, flexor digiti minimi, apponens digiti minimi. यहाँ पर adduction की जरूरत नहीं है हमें, तो adductor नहीं आई. Clear? So the name same है, abductor pollicis brevis, यहाँ abductor digiti minimi, वहाँ है flexor pollicis brevis, there is a abductor flexor digiti minimi, apponens pollicis और यहाँ आ गया apponens digiti minimi. Clear? Now one by one the origin, insertion, nerve supply and the action of these muscles. Most of the muscles they arises from the flexor retinaculum. यहाँ पर flexor retinaculum है और वहीं पर जो carpal bones है वहीं से ये arise हो रही है. तो lateral side पे हमारी it arises from this abductor pollicis brevis, सबसे superficial muscles है. सबसे पहले आपको यही दिखाई देगी. It arises from the flexor retinaculum. It arises from the tubercle of the scaphoid and the crest of the trapezium, जिससे हमारा flexor retinaculum attached है. Clear? और वहीं से ये muscles arise हो रही है. Insertion is into the base of the proximal phalanx of the thumb on the lateral side. Most of the muscles they inserted into this lateral side of the thumb in the proximal phalanx, base of the proximal phalanx on the lateral side of. Clear? Nerve supply, because these muscles are found on the medial side of the nerve supply is, palm में 2 ही nerve है हमारी, median and the ulnar nerve. So that means this muscle is supplied by the median nerve. Ulnar nerve medial side पे होगी. This is the lateral side पे median nerve. Action, as the name is the abductor pollicis brevis. That means it helps in the abduction of the thumb. Clear? नाम ही उसका है तो उसके अकॉर्डिंग उसका एक्शन हो जाएगा. So this is the muscle जो सुपरफिशियल आपके है, उसके नीचे थोड़ा सा दिखाई देगी आपको फ्लेक्सर, सॉरी दिस साइड, दिस इज द एब्डक्टर पॉलिसिस ब्रेविस, उसके नीचे आपको दिखाई देगी फ्लेक्सर पॉलिसिस ब्रेविस. एब्डक्टर को हम कट करेंगे. So the second muscle is the flexor pollicis brevis. Again it is found on the lateral side, so it also arises from the flexor retinaculum and the trapezium crest. Clear? Same है insertion, same उसी तरह से है proximal phalanx on the lateral side of the thumb. Okay, base of the proximal phalanx, nerve supply is same, median nerve, name is flexor pollicis brevis, so the function is flexion of the thumb. Clear? Opponens pollicis, again the same muscles of the lateral side, so arises from this flexor retinaculum and the trapezium, crest of the trapezium, same origin. Insertion, the only difference in the insertion is inserted into the first metacarpal bone. ये यहाँ पर होती है distal part of the first metacarpal bone on the lateral side. Again ये lateral side पे ही inserted है. ये हमारी proximal के base पे नहीं insert हुई, तो head of the first metacarpal bones पे insert, उसी के बिल्कुल पास में है. Same nerve supplies by the median nerve, and the action is, as the name is opponens, that means the thumb, it touches the tip of the other fingers. This is named as the opponens actions. So just deep to this abductor pollicis brevis, उसके deep में flexor pollicis, this abductor pollicis brevis, उसके नीचे आपकी दिखाई देगी flexor pollicis brevis, और उसके नीचे आपको दिखाई देगी opponens pollicis. Now the fourth is the adductor pollicis. Adductor pollicis के there are two head और थोड़ा सा उससे हट करके है. Okay, there is a transverse head and the oblique head. So there is a different origin of these muscles. The oblique head, it arises from the capitate and the trapezoid second and third metacarpal base. Okay, so it arises from, this is the second metacarpal, this is the second, and this is the third metacarpal. So the base of the second and the third metacarpal, और यहीं पर हमारी कौन सी दिखाई दे रही, distal row की bones नजर आ रही है. So it arises from this capitate and the trapezoid. Okay, and the transverse head, ये ऊपर वाली जो दिखाई दे रही है आपको transversely arranged है. This is the transverse head. It arises from the shaft of the third metacarpal जो आपको दिखाई दे रहा है. Both the head they inserted into, again same insertion है जैसे others का है, but it is on the medial side, क्योंकि ये निकल रही है तुम्हारी medial से, तो lateral पे तो जाएगी नहीं क्रॉस करके. So it is inserted into the base of the proximal phalanx on the medial side. Or when there is a contraction of this muscle, helps in the adduction. Yeah? तो इसका काम adduction है, so it inserted on the medial side of the base of the proximal phalanx. And this muscle is found medially, so this muscle is supplied by the ulnar nerve. Okay, as compared to the other muscles of this thenar eminence, which are supplied by the median nerve, now this muscle is supplied by the ulnar nerve. Okay, and the action, as the name is adductor pollicis, that means it is supplied by the nerve. Sorry, the function of this muscle is adduction of the thumb. So these are the muscles, superficial to deep. सबसे superficial जो आपको दिखाई दे रही है, this is the abductor pollicis brevis. Just उसके नीचे जो नजर आ रही है, this is the flexor pollicis brevis, and thus उसके और नीचे अगर आप जाते हो, there is the oblique head of this adductor pollicis, and this is the transverse head of the adductor pollicis. और हम flexor और abductor pollicis को रिमूव करते हैं, तो उसके नीचे आपको दिखाई देगी opponens pollicis का थोड़ा सा पार्ट यहाँ दिखाई दे रहा है इस डायग्राम में. So these are the muscles, four muscles which are found on the lateral side, helps in the formation of this thenar eminence of the palm. So they are named as the thenar group of the muscles. तो इसमें से किसी में भी short note पूछा जा सकता है. So you should write the origin, insertion, nerve supply and the action of these muscles. Again, these are the muscles. Now, they have the thenar muscles, they have the general origin जो हमने बताया था, lateral side of the flexor retinaculum से ये arise हो रही हैं सभी की सभी, and lateral two carpals, scaphoid and trapezium. ठीक है, सभी का mostly उसी से है, except this adductor pollicis को छोड़ करके all the three muscles. तो आपको origin and the nerve supply is same. Okay, action is according to the name of the muscles. Clear? Except the nerve supply of this adductor pollicis, which is by the ulnar nerve and the origin is different again. And all have the, again the insertion is same, this base of the proximal phalanx on the lateral side. This adductor pollicis is on the medial side, same in this base of the proximal phalanx, and the opponens pollicis, its insertion is on the lateral side but in the first metacarpal bone or the head of the first metacarpal bone, which is close to the base of first phalanx or the proximal phalanx. So this is again picture to show, this is the opponens, abductor pollicis brevis, this is the flexor pollicis brevis, and these are the adductor pollicis. Now the hypothenar muscles, again the origin, insertion, nerve supply, there are the three muscles are there, hypothenar, okay. The name is changed, सिर्फ digiti minimi change हुआ है, otherwise this is the abductor digiti minimi, second is the flexor digiti minimi, third is the opponens digiti minimi. ठीक है, सिर्फ which is a digiti minimi change हुआ है, otherwise the name is same. So arises, these are found on the medial side. तो medial side पे जो दो bone है हमारी pisiform. Okay, so it arises from the pisiform bone, and this abductor digiti minimi also arises from the tendon of this flexor carpi ulnaris. Bone is itself this pisiform bone formed within this flexor carpi ulnaris tendon. Inserted into the base of the proximal phalanx of the little toe. Again, insertion is same है, base of the proximal phalanx वहाँ thumb था और यहाँ क्या है, little finger. Clear? Now, because it is found on the medial side, so the nerve supply is by the ulnar nerve. Clear? Action is that the name is the abductor digiti minimi. That means this muscle helps in the abduction of the little toe. Sorry, this little finger. Clear? तो नेम से एक्शंस क्लियर आ जाएगा. मीडियल साइड की है तो अल्नर नर्व से है और मीडियल साइड की बोन से हमारी अराइज हो रही है. सेकेंड इज द फ्लेक्सर डिजिटाई मिनिमाई. इट अराइजेस अगेन फ्रॉम द मीडियल साइड, फ्रॉम द मीडियल पार्ट ऑफ द फ्लेक्सर रेटिकुलम एंड द हुक ऑफ द हेमिड बोन. ठीक, थोड़ा सा डिस्टल है. इंसर्शन अगेन द सेम बेस ऑफ द प्रोक्सिमल फैलेंक्स ऑफ द लिटिल फिंगर. क्लियर? सेम रहेगा. और ऑल्सो दिस inserted into the lateral side, अगर specify हम इसे करेंगे so on the medial side. Okay, this is the abductor digiti minimi and this is the flexor digiti minimi. और ये हमारा है flexor retinaculum. Nerve supply same होगा, ulnar nerve medial side की है. Action is same. The name is flexor digiti minimi. That means it helps in the flexion of the little finger. Opponens digiti minimi, as this opponens pollicis again arises from the medial side of the flexor retinaculum and the hook of the hamate, same origin है. And the insertion like the flexor pollicis brevis की तरह it inserted into the shaft of the metacarpal. Again it is inserted, वो हमारी किस पे insert हो रही थी? The first metacarpal पे insert हो रही थी और ये fifth metacarpal पे insert हो रही है. Again on this distal side, and then this nerve supply is again, this is on the medial side, so the nerve supply is by the ulnar nerve and the action is opponens digiti minimi है, so that means again it touches the thumb especially, okay, tip of the thumb. So it is named as the opponens digiti minimi. So this is the opponens digiti minimi, ये आपको दिखाई दे रही है, inserted into this fifth shaft of the fifth metacarpal bone. So these are the muscles. These are the thenar group of the muscles and these are the hypothenar group of the muscles. And in the hypothenar again there is a general origin is from this medial part of the flexor retinaculum. Okay, and the medial two carpal bone pisiform और the hamate से सब arise हो जा रही हैं. तीनों ही have the general insertion proximal phalanx of the medial side of the proximal phalanx, base of the proximal phalanx of the little finger, except the opponens digiti minimi like the opponens pollicis which inserted into the fifth metacarpal bone. Opponens जो हमारी pollicis वाली है first में insert हो रही है और ये हो रही है fifth में. So again, this is the picture same to show this thenar and hypothenar muscles. Now the central group of the muscles, these are the lumbricals, and there are 4 lumbricals. Okay, and they are first and the second are unipinnate muscles. First and the second lumbricals, they are unipinnate, and all the lumbricals they arises from the flexor digitorum profundus tendon. जो deep muscles थी हमारी, all lumbricals they arises from the muscles. ये सब muscles से arise हो रही हैं, and this muscle is the flexor digitorum profundus. Okay, first and the second जो हमारी है, they are arises from this lateral side of the flexor digitorum profundus, and they are for the index and the middle fingers के लिए. Okay, जो tendon of this flexor digitorum profundus, which is for the index and the middle fingers, उसके हमारे lateral side से arise हो रही हैं. These are the unipinnate muscles, and they inserted into the extensor expansions on the dorsum of the these fingers. Dorsal aspect पे आपके बना होता है triangular shaped, which is named as a dorsal extensor expansions भी बोलते हैं, या extensor expansions भी उसे बोलते हैं. It is formed by this extensor digitorum tendons. Okay, so these muscles they inserted into this dorsal digital expansion or the extensor expansions. Now supply, because these are the muscles on the lateral side, index और middle finger के tendon से lateral side से arise हो रही, so they are supplied by the median nerve. And the action is extensions of the interphalangeal joint, because they inserted into the dorsal digital expansions. तो उसके साथ क्या करेगी, when this muscles contract, arises from this palmar aspect, inserted into the dorsal aspect. So when there is a contraction of these muscles, it helps in the extensions of this interphalangeal joint. Okay, and now at the same time, ये extension expansions पे है, इसलिए हमने बोल दिया it helps in the extensions, but because they crosses which joint, metacarpophalangeal joint, so they helps in this flexion at this metacarpophalangeal joint. Now the third and the fourth lumbricals, they are named as the bipinnate muscles. Adjacent side की tendon से arise हो रही हैं. Okay, so the tendon of the flexor digitorum profundus, the adjacent sides of the middle ring and the little fingers. Okay, जो middle के लिए जो tendon जा रहा था, ring fingers के लिए जो tendon जा रहा है, little fingers के लिए जो tendon जा रहा है, उसके adjacent side से ये arise हुई हैं bipinnate muscles, and they again inserted into this dorsal digital expansions. Clear? यहाँ चला जाएगा. Because these muscles are found on the medial side, so they are supplied by the ulnar nerve, and the action is same, because they inserted into this extensor expansion, so helps in the extension of the fingers. Okay, and by the contractions they helps in the flexion at the metacarpophalangeal joint. Now these are the muscles. These are 4 tendons आपको दिखाई दे रहे हैं flexor digitorum profundus के. Okay, and these from the lateral side of this tendon for the index and the middle finger, this lateral side पे आपको muscles arise लग रही हैं. Okay, they crosses metacarpophalangeal joint, goes on the dorsal aspect of the fingers. Okay, and inserted into the in the dorsal aspect into the dorsal digital expansions. Okay, and this third and the fourth, they are bipinnate, arises from the adjacent tendon of the middle finger for the middle finger and the ring fingers, adjacent tendon of this ring fingers and the little fingers. Clear? And they inserted again the cross metacarpophalangeal joints. Okay, and inserted into the dorsal side to the, for this ring and the little fingers in the dorsal digital expansion. Now after this lumbricals, now is the introchei. Introchei group of the muscles, they are the 2 types of the introchei. One is the palmar introchei and second is the dorsal introchei. Again, these are the palmar introchei are 4, dorsal introchei are 4. Introchei means they arises from the adjacent side of the bone se arise ho rahi hai. Okay, so some there are the unipinnate muscles, they arises from one side of the bone. When they are bipinnate, they arises from the adjacent bone. और ये बोन जो यहाँ पर लॉन्ग बोन जिनसे ये अराइज हो रही है, दीज आर द मेटाकार्पल्स, दे अराइजेस फ्रॉम द मेटाकार्पल्स. So just deep to this lumbricals, these introchai, when we remove the lumbricals and the long flexor tendons of the fingers, just deep to this, these introchai are found. जहां हम बोन में पहुंच गए हैं तो बोन के बीच से ये अराइज हो रही हैं, तो उस लेवल पे आपको ये मसल्स दिखाई देंगे. क्लियर? So the palmar introchai, they numbered from this, again the lateral to the medial side, they are unipinnate palmar and do not arise from the metacarpals of the middle finger, because they arise, they are the four. Okay, they the first, second, they arise from first, second, and third से नहीं arise हो रहा है, fourth and fifth से arise हो रही है. Okay, they are the unipinnate. So the first palmar introchai, the origin is from the first metacarpal bone shaft of the first metacarpal. इस reasons पे आएगा आपका, यहाँ से arise हुई. Insertion in the base of the proximal phalanx of the thumb, medial side पे चली जाएगी. Proximal phalanx of the thumb के medial side पे चली गई है, base पे. फर्स्ट इस रीजन्स में आपको दिखाई देगी, इट अराइजेस फ्रॉम दिस एंड इंसर्टेड हेयर. ओके, यहाँ पे फर्स्ट आपको दिखाई नहीं दे रही है, रेस्ट ऑफ द palmar introchai आपको नजर आ रही हैं. unipinnate है. सेकेंड, थर्ड एंड द फोर्थ. सेकेंड अराइजेस फ्रॉम द मीडियल साइड ऑफ द शेफ्ट ऑफ दिस सेकेंड मेटाकार्पल्स जो है हमारी, इसके मीडियल साइड से हमारी अराइज हुई. ओके, एंड इंसर्टेड इनटू दिस थर्ड, इट अराइजेस फ्रॉम दिस मिडिल वाले से तो होना नहीं है. नाउ द थर्ड मेटाकार्पल से आ रही है, सो इट अराइजेस फ्रॉम दिस लेटरल साइड ऑफ द शेफ्ट ऑफ द फोर्थ मेटाकार्पल. ओके, फोर्थ मेटाकार्पल की शेफ्ट से आ रही लेटरल साइड से, और जब फोर्थ वाली है, इट अराइजेस फ्रॉम द शेफ्ट ऑफ द मीडियल साइड ऑफ दिस, सॉरी दिस लेटरल साइड ऑफ द शेफ्ट ऑफ दिस फिफ्थ मेटाकार्पल. सो जो मीडियल टू है, दे अराइजेस फ्रॉम द लेटरल साइड, और जो lateral टू है, they arises from the medial side of the shaft. Okay, insertion again ये सबकी सब dorsal digital expansions में insert होना है इन्होंने, so they cross the metacarpophalangeal joints, inserted into the dorsal digital expansions. And these palmar introchai and the dorsal introchai, they all supplied by the ulnar nerve, the branch of the ulnar nerve. इसे medial का चक्कर कोई है ही नहीं कि lateral है तो medial या कुछ नहीं, सारी ulnar nerve से branches apply. And the function of this palmar introchai, because they are found in the palmar side, so when there is a contraction, they helps in the adduction of the finger. There is a middle fingers के along जो है, in response to the midline of this hand or the middle finger, when the fingers they comes close to the midline, they are named as the adductions. When the fingers they go away from this midline, it is named as the abduction of the finger. Okay, adduction and the abduction. So these palmar introchai, they helps in the adduction of the finger. Okay, and the dorsal introchai, they helps in the abduction of the finger. Clear? So this is the second, and this is the third, and this is the fourth palmar introchai. They cross this metacarpophalangeal joints and goes into the dorsal side, and because when they contract, they brings this index fingers towards the middle. Again, on this side, because they arises from the lateral surface of this fourth and the fifth metacarpal, so when these muscles contract, they bring this ring finger and the little fingers towards the midline, so they helps in the adduction of the fingers. Now the dorsal introchai, they are again 4 in numbers, but they are bipinnate muscles. Okay, palmar introchai, they are unipinnate muscles, and these are bipinnate muscles. That means the adjacent side of the metacarpal से ये arise हो रही है दोनों side से. And so they have the two head of the origin. आप बोल सकते हो इसको. The first they arises from the adjacent side of the shaft of the first and the second metacarpal bone. First and second के adjacent side से. Okay. And the second adjacent side of the second and the third from this adjacent side of the third and the fourth arises from the adjacent side of the fourth and the fifth metacarpals. Okay, bipinnate है, two head of origin हो जाएगा, दो बोन से arise हो रही हैं. Insertion again into the dorsal digital expansions, तो कहाँ जा रही हैं? They inserted into the base of the second, third and fourth. First में नहीं जा रही हैं, they inserted into the second, third, okay, नहीं, थर्ड में जाएंगी, थर्ड के दोनों साइड पे जा रही है, मीडियल एंड द लैटरल साइड पे, ओके, एंड इनटू द फोर्थ. Ulnar nerve same like the palmar introcheic is supplied by the ulnar nerve, okay, this dorsal introcheic is also, and the action is because they inserted into this both the this introcheic, they inserted on both side of this middle phalanx, so they helps in the abduction of this these in fingers. These are the muscles arises from this first, second, okay, and the second, third, fourth, and the fifth. So when there is a contraction of these muscles occurs, what they do, fingers को away कर देंगी, ठीक है, away from this midline. So ये तो तुम्हारी midline पे ही रहेगी, middle finger कहीं जा नहीं रही है, but the adjacent fingers, this index and the ring fingers, they goes away from the midline, so helps in the abduction when this muscle contract. So again, this is a picture to show this thenar muscles and the hypothenar muscles, and in the deep, these are the tendons of the flexor digitorum profundus, and these are the lumbricus muscles. Lumbrical और flexor digitorum tendons, digitorum profundus को हम हटाएंगे तब आपको दिखाई देंगी introcheic muscles. So in the hand, when we dissect, remove this deep fascia, the skin, superficial fascia and the deep fascia, then we see this, these are the muscles. On the lateral side जो आपको दिखाई दे रही सबसे पहले superficial नजर आएगी, this is the abductor pollicis brevis. ठीक है, अगर इसकी margins को आप trace करते हो तो थोड़ा सा part आपको दिखाई देगा opponens pollicis का, and on the superior side there is a flexor pollicis brevis. So when we remove this abductor pollicis brevis, then we will clearly see this flexor pollicis brevis and the opponens pollicis. और upper level पे आप जाते हो distally, so there are the fibers of this abductor pollicis, इस regions पे आपको adductor pollicis यहाँ इस regions पे आपको दिखाई देंगे. And on the medial side जो आपको muscles दिखाई दे रही है superficial, again this is the abductor digiti minimi, और इसके medially आपको दिखाई देगी flexor digiti minimi जो कट कर दी है, उसके नीचे दिखाई देगी आपको opponens. तो opponens थोड़ा deep में है, and there are the tendons आपको इस region में दिखाई दे रहे हैं. The tendon, it goes towards the thumb, that means this is the tendon of the flexor pollicis longus, and they are the tendons of flexor digitorum superficialis and profundus. And in the center में जो आपको muscles दिखाई दे रही हैं, lateral और medial side पे these are the muscles of the thenar and the hypothenar eminence, लेकिन जो center में आपको दिखाई दे रही superficially muscles, these are the lumbricals. Clear? So the lateral to medial, they are the first, second, third and fourth lumbricals, और इसके depth में इनको हटाने के बाद आपको दिखाई देंगी introcheic. हमने abductor pollicis brevis को remove किया है, थोड़ा detach किया, तो यहाँ आपको दिखाई दे रही flexor pollicis brevis, और ये नजर आ रही है opponens pollicis. Okay, and these are the lumbricals here, and this is the oblique transverse and the oblique head. आपने flexor को हटाया है, तो उसके बाद आपको clearly दिखाई दे रही, this is the oblique head and this is the transverse head of the adductor pollicis. और आपने टेंडन्स सब कट कर दिए यहाँ से, फ्लेक्सर डिजिटोरम सुपरफिशियलिस प्रोफंडस, लुम्ब्राइकल्स आपने हटाई, तो आपको यहाँ ये दिखाई दे रही है, दीज आर द इंट्रोचेक, ओके, बिटवीन द मेटाकार्पस बोन. सो दैट्स ऑल अबाउट मसल्स ऑफ द हैंड स्पेशली. तो आपको कभी लुम्ब्राइकल्स शॉर्ट नोट में पूछा जा सकता है, इंट्रोचेक शॉर्ट नोट में पूछा जा सकता है, मसल्स ऑफ दिस थिनार एमिनेंस या थिनार ग्रुप और द मसल्स ऑफ द हाइपोथिनार ग्रुप्स. ठीक है.